everybody, Eileen the Fam here. Hope you all having a great day. Welcome back to my mini-series on PTSD. Before we start with the third segment of it, as always, I want to go over and just recap everything that we went through. In the first video, we discussed what PTSD is, which is short for post-traumatic stress disorder, which is caused from a traumatic event that could happen in your life, like military, being in the war, or rape, or child abuse, anything that was severely traumatic to you. We discussed that most people that go through things, with time it gets better, but with PTSD, instead of getting better, it gets worse. And the duration of it, some people get it within a month after their traumatic event. Sometimes it doesn't show up for years. The triggers of it could be anything from everyday occurrences to maybe a show that has a scene in it that reminds you of what you went through. The second video, like I said, we went through all the nightmares of it. We went through each and every symptom of it in detail. And in today's video, we are going to start off by discussing the intensity of the symptoms. Okay, and before I start, like I said, I just want to remind everybody again that I am legally blind. I'm not trying to look for sympathy or anything, because I don't need sympathy. I can do very well on my own. I'm just letting you know, because there will be times when you see me looking down at my notes. So, please bear with me on that. So, saying that, let's get started. Okay. PTSD symptoms can vary in intensity over time. You may have more PTSD symptoms when you're stressed in general. You know, if it's a stressful day, that could trigger your PTSD. Or when you come across reminders, like I says, you could have a quiet day, and then all of a sudden you're watching a program and it shows something that triggers that. Like, if it was like, say, child abuse, and you were watching a show when you seen something where children would be abused, that could trigger it. Or if you got raped and you seen a rape scene, that could trigger it. So those things could happen. Or you may just see, a report in the news on sexual assault and feel overcome by memories if you've been sexually assaulted, like I said. Just common everyday things can trigger it, and that's why it's so much worse than just anxiety. You need to know when to see a doctor when you have this. If you get disturbing thoughts or feelings about the traumatic event that last more than a month, if it doesn't go away, of course you're going to have it. But if them feelings last for over a month, please go get seen. Because it could be a sign that you have PTSD. And if you're having trouble getting your life back under control, these are signs that you really need to have a doctor see you, because there is medications out there for PTSD, just like any other mental disorder, and there's other treatments that help, which we'll go over a lot of them. If you have suicidal thoughts, because PTSD will trigger suicidal thoughts, please, I implore you, call a family member, a friend, the hotline for suicide. Get help, because you matter. You know, no matter what you went through, your past is your past. We can't always escape our past, I know that. But you need to know you matter. Your life does count. You are important. And you're uniquely made. Nobody or nothing is worth losing your life over. And PTSD will make you feel like you have no reason to live. But believe me, you do. And things will get better. So when you get them thoughts, please think of the people that you hurt. You may feel better, but in the long run, you're doing more damage by killing yourself because you hurt those that love you. You know? So please, if you get any type of suicidal thoughts, please reach out and get help. If you don't want to call a suicidal hotline and you don't feel you have friends, I'm speaking to you out there. That's right, you. If you, for some reason, I don't care if it's PTSD or anything else, if you're having thoughts like that and you need to reach out, I'm here. That's right, reach out, I'm here, come on. Don't go it alone. That's the worst thing that you could do. Reach out. You have friends. I care about you. You matter to me. Okay, so do me that favor and reach out. Now, if you reach out to everybody and you get medical care and that's not helping, you need to know when to get emergency help, and we're going to cover that too. If you think you may hurt yourself and you attempt it, please, if you can't get a hold of me, you can't get a hold of your friends, can't get a hold of your doctor, call 911 and tell them I have PTSD and I just can't handle it no more. Please help me. And they'll be there. But I can guarantee you, if you reach out to me, I'll be there for you. I promise you that. If you ever need me for anything, I'm here. All you have to do is reach out to me on Twitter. You reach out to me on Twitter, I'll DM you my personal number, and I will talk to you as long as you need talking to. I've been where you are. Nobody, and I mean nobody, should go it alone. Let me tell you a little personal story before we continue. When I lost my husband, my family, first of all, keep in mind, my family is scattered in different states. I'm the only one in my family here in Texas. The only one. So when I lost my husband, he died at home by his wish. He wanted to die in his home, not in a hospital. So I granted him his wish. It was hard, but that was his wish. So I wanted him to have his wish. Let me tell you how hard it was emotionally. When you watch somebody that you love very, very much go from a strong, independent person to somebody that's like a rag doll, lose their mental thinking, being able to do a lot of things, just walking down the street and tripping and falling, losing their independence and everything. When you see all this happening in front of your eyes, it can tear you apart. If you do not have a backup system, which unfortunately, like I said, my families were scattered. I didn't have a support system. I didn't have any support system, so I know what it feels like to want to give up, throw the towel in, and just say the heck with it. Believe me, I've been there. I know. I lucked out when I was able to get hospice. They were taking care of him, but until a volunteer came, because all the regular hospice did, I could get maybe an hour of peace and quiet without thinking about what was happening. But without the volunteer, that wasn't enough. I needed to go away for a couple of hours, not think about him, not think about what was happening. Because if I didn't have that, I would have been in the grave right beside him or in a mental hospital. So I know what it's like to have no support. I don't want anybody to go through that. Remember, I'm here for you. Let me be part of your support system. You need to reach out to me. Reach out. I'm here. I'm here for you. I want to reach out from my heart to your heart. I want to be your virtual hug, your virtual shoulder to cry on. If you need somebody to talk to, just literally talk to. Let me be there to listen to you. I will give you my phone number if you DM me and you have a serious problem. I will be there for you. I don't care if it's morning, afternoon, or night. I don't want anybody with any type of a problem to go out and have to suffer alone. You shouldn't have to. Because you're wanted, you're loved, you're cared for, and you matter to me. Know that you are important to me. Every one of you out there. We all have a reason for being here. We are all important. We all matter. Every life matters. So don't ever think you don't matter, because you do. You're very important to me. Okay? But if for some reason you're not comfortable talking to me or anybody else, then just please call 911 and get help. Don't throw in the towel. Your life is too precious for that. Now, there's many causes for PTSD. Like I said, some could be from war experience, child abuse, rape, sexual assault. There's many causes out there. You could go through it if somebody threatened you. I could give you some experiences that I'm talking about, but I'm not going to. But just know that there are causes and there is help out there. Like stressful experiences can bring it on. Inherited mental health could give you PTSD. Inherited features of your personality, like your temperament, the way your brain regulates the chemicals. There's so many different reasons that, things that can cause PTSD. If you think you have it, reach out. I'll talk to you. I can help with it. Later on in this segment, not right now, but as we go along, I'm going to also cover the other side of PTSD, which is living with somebody with PTSD and how to help them. So don't feel like you're going to be alone, because I've been on both sides of this bridge here. I've been on both sides of this fence. I know what it is both ways. I know what it is to have PTSD. I know what it's like to live with somebody with PTSD, and I know what to do to help that person. And believe me, helping that person could help them have a better life. And that's what I want to do with you. I want to help you. So please, let me help you. Reach out to me if you have to. I'm here. Like I said, and you experiencing intense or long-lasting trauma can trigger PTSD. Having experienced any type of trauma, having a job that increases your risk, helping other mental health problems, such as, if you have anxiety, depression, that can cause PTSD. Having problems with substance misuse, such as excess drinking or drugs, can give you issues with it. Like I said, lacking a good support system of family and friends. That's why I want you to know I'm here. I want to mark that one off your list if I can. I want to be here for you. Okay? Having blood relatives that have mental health issues could make you a risk for having it. The kind of traumatic events that we're talking about that causes it is combat exposure, child physical abuse, sexual violence, physical assault, being threatened with a weapon, or in an accident. Those are the type of things that can cause PTSD. The complications of PTSD, well, it's simple. It can disrupt your whole life, your job, your relationships, your health, your enjoyment. It will give you, you can get severe depression and anxiety, issues with drugs and alcohol, eating disorders, and suicidal thoughts. But there is prevention out there for it. And so please, let me help you with the prevention. And even if you have it, let me walk with you through this. Let me be there for you. After surviving a traumatic event, many PTSD symptoms, go away after a while, but some don't. You'll get fear, anxiety, anger, depression, guilt. They're all common, reactions to the trauma. But, unfortunately, the majority of people exposed to trauma don't develop them long term. But with PTSD, you do. They just don't go away. So, if you're having anxiety and it's like constant, then maybe they need to switch you and treat you for something different. You need to ask your doctor if there's, by chance, you could have PTSD. And then can put you on a better medication. Getting timely help and support, to prevent normal stress reactions from getting worse is the best way to go. This, can be anywhere from the onset of it, from talking to somebody, reaching out, to getting medical help for it, okay? And that's how you deal with it. Like I said, it's a serious mental disorder. I don't want anybody to take it lightly. Any type of mental health issue is serious. None of it should be taken into, lightly. But always remember, before I go, I want to reiterate this to you. You matter. You're one of a kind. You're important. And I love you. For you. As a human being, you're special. You are uniquely made. You weren't made to go through this. Don't suffer any type of mental illness alone. Reach out. If you feel you don't have close family or friends, then reach out to me if you want. I'm here for you. From my heart to your heart. Okay? Mwah. Bye. Love you.